Greetings. I'm Dr. Franzi. I'm a registered certified trainer for thought field therapy. I've been teaching TFT all over North America and Europe since 2000. It's been my privilege to be invited to facilitate the transformation of hundreds of lives rapidly, gently, effectively with thought field therapy. Today I want to tell you about collarbone breathing. Collarbone breathing was developed by Dr. Roger Callahan, founder and developer of thought field therapy. Collarbone breathing only takes a minute of your time, but can have a very far-reaching effect on your overall well-being. Collarbone breathing is like a reset button for your brain. Doing this simple and safe treatment neurologically reorganizes your brain and thus often allows even very resistant problems to respond to TFT treatments. Collarbone breathing can be done within the context of a TFT treatment or entirely by itself. Use collarbone breathing when you have patients who constantly bump into things, when reading makes them sleepy, whose performance is declining. If you have clients whose gait is unbalanced, are awkward or uncoordinated, who self-sabotage and constantly procrastinate, use collarbone breathing. If you have patients who are overcoming any kind of addictions or cravings, anxiety or panic disorder, obsessive-compulsive disorder, we recommend they build collarbone breathing into their daily TFT routine. Collarbone breathing is also often useful in the treatment of attention deficit disorder, learning disabilities, dyslexia, stuttering, Tourette syndrome, and schizophrenia. In short, any condition that affects lifestyle and quality of life can greatly benefit from collarbone breathing treatments. I'm now going to model collarbone breathing for you. You will see the treatment in its entirety, and then we will break it down into its individual components. So this is what it looks like. As you can see, there are three components to collarbone breathing: the breathing part, the holding positions, and the tapping. Let's look at them individually. Please join me in the following short exercise. Let's do the breathing first. First, we take a deep breath in, hold it, halfway out, hold it, all the way out, hold it, halfway in, hold it, and now we breathe naturally, so we don't hyperventilate. Let's do that again. Big breath in, hold it, halfway out, hold it, all the way out, hold it, halfway in, hold it, and breathe naturally. One more time. Big breath, halfway out, all the way out, halfway in, and breathing naturally. Let's do the holding positions. Take two fingers, index and middle finger, tuck all your other fingers in, and put them on one of your collarbone spots. You find your collarbone spots by going straight down from your chin to where a gentleman would tie his tie, down an inch and over an inch, little indentation there. Put two fingers there, all the other fingers are tucked in, your elbow is off. Think of it as an electric circuit. You don't want to shortcut it anywhere with fingers touching or elbows touching. Everything tucked in, and first collarbone spot, bring it over to the other collarbone spot. Now go down on your knuckles and back to first position. Great, let's do that again. Up, over, down, and over. We're going to do exactly the same thing with your other hand. Fingers tucked in, elbow off the body, first collarbone spot, up, over, down onto the knuckles in the same spot, and over again. Let's do that one more time. Up, over, down, and over. Let's do it one more time, starting with the other hand. Two fingers, collarbone spot, everything tucked in, elbow off, up, over, down, over, and switching the hands. Two fingers tucked in, on the collarbone spot, up, over, down, and over. Excellent. So the last component we're adding is the tapping. As you're holding your fingers there, with the other hand, they become the tapper now. I'd like you to find a very important acupressure spot on the back of your hand. It's called the gamut spot. We use it a lot in thought field therapy, and it has a very universal application. Gamut spot is found between the little finger and the ring finger, right there in that groove between the bones. Everything tucked in, elbow off, tapping the gamut spot. Move everything over to the other point and tapping. Down on the knuckles and back into first position and tapping there. Great. We're going to switch now. The tapper becomes the holder. The holder becomes the new tapper. Elbows off, fingers tucked in, and moving over and down on the knuckles and over again. Excellent. Now we're putting all components together. We're adding the breathing. Remember, big breath, halfway out, all the way out, halfway in, as we're doing all this tapping and holding. Fingers tucked in, elbow off, tapping the gamut spot on the back of the hand. Big breath in, halfway out, all the way out, halfway in. Moving over, big breath in, halfway out, all the way out, halfway in. Down on the knuckles, big breath, halfway out, all the way out, halfway in. Moving, breathing normally as you go back to first position, tapping, big breath in, halfway out, hold it, all the way out, hold it, halfway in, and switching. The tapper becomes the new holder. The holder becomes the new tapper. And elbows off, fingers tucked in, big breath in, halfway out, all the way out, halfway in, over to the other position, tapping, big breath, halfway out, all the way out, halfway in, down on the knuckles, big breath, halfway out, all the way out, halfway in, and back to first position. We're almost done. All the way in, halfway out, all the way out, halfway in, and you're done. You've just done a total of 40 breathing and holding positions. Let's do it one more time together. On the collarbone spot, fingers tucked in, elbow off, tapping the gamut spot, big breath, halfway out, all the way out, halfway in. Over to the other position, big breath, halfway out, all the way out, halfway in. Down on the knuckles, tapping and breathing, halfway out, all the way out, halfway in. Back to first position, big breath, halfway out, all the way out, halfway in. Great. Tapper becomes the holder. Holder becomes the tapper. Tapping the gamut spot on the back of the hand between the little finger and the ring finger, right there in that groove. Big breath. Halfway out, all the way out, halfway in. Big breath. Halfway out, all the way out, halfway in. Big breath. And moving back over, big breath, halfway out. And you're done. Thank you for learning collarbone breathing.